Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk about some other things about orthodontics that ought to be taught to everybody that messes with teeth or knows about it. And I am stuck on getting the pediatric parts of the university that teach the pediatric dentists orthodontics. If they don't, they don't let them do the orthodontics. They ought to be the one doing stuff, and they don't teach this pediatric stuff to their people learning orthodontics even. All right, let's get on with this problem I have here. I want to talk to you about follicular movement of teeth. And this is something that is done, and I'm going to just go straight from this little girl right here had a problem with crowded teeth. And this has happened all over the world. They have mixed up people. You get somebody with a small facial structure, and then they marry somebody with a large facial structure, and the children sometimes end up with a big tooth in the small box over here. It's just that simple. And for people to run around saying, well, we don't extract teeth, this is absolutely stupid. You've got to get the tooth to fit the person, or else you have to shove them back here and then extract the wisdom teeth, which is another stupid thing. If they take out something in between, pull this forward and go back here, leave the wisdom teeth alone. That's another thing. But what I want to cover today is follicular movement of teeth. Now, the follicle is a sac that is around each tooth. And if where you can see this x-ray right now, see this cuspid tooth here, it has a follicle around it. Now, when it runs up against another tooth, it makes a dent. It'll be the crown will be in there, and then it'll have an indentation like that where it's butting against another tooth. If you get this out of the way, this thing will form a circle there, and it'll move this tooth in that direction right there. And you can watch this happen on this case right here. Now look at this tooth out here. It is hopelessly impacted. It is a pain. If you tried to expand this and get this tooth up here, you'd have such a surgical problem straightening this tooth up. But watch what you can do with follicular movement of extremely crowded cases. And this is true today, and it'll be true 100 years from now. If your teeth are the same way, these follicles are going to form a circle. That circle will hold more than any other shape you can come up with, and that's why the planets, everything floating around up in the heavens, is in a round form. If it wasn't, that would change. Now, so this fact of nature is you drop a drop of water and it goes to a circle, except if it's falling through a lot of air, it'll taper off. They make round balls of things, dropping it into water, it makes a little round deal. And that fact is in teeth, and I don't care if you think you're going to lose this 50 years from now, it'll change. This fact will be around here as long as this earth's here. That's a fact. Now, let's watch this. Look over on this side. This tooth's coming in here, hopelessly impacted. There's a permanent lateral right here, and you can see it. And now I want this tooth to come over here. I want to keep the cuspids. Now you can sacrifice a bicuspid. It's not near as good as a cuspid. So we come down here, we're going to extract the bicuspid tooth and the baby tooth in here. Here's this tooth around here coming up, and it's running into a permanent tooth. I'm sorry, I got this thing messed up. I'll have to go back over here. What did I do here that I messed up? Keep the discount. I'm going to say keep it. All right. Now I have to go back. All right, maybe we're back at gear here. Now, this is hopelessly impacted. This tooth is too. And the cuspid up here has a problem. It's not as big as that. This is a problem too right here. Now let's see what happens here. All right, I can't even see this x-ray myself, but we took these teeth out right in through here. Look where this tooth is backed off of here, up here. Now, down on the bottom, where we took this out, I went back when I touched it. Now this tooth is going to come out of here. Well, this thing's going crazy. I touched something and it enlarged. All right, well, that's okay. It's big. Now this tooth we're going to have to, move it. I don't know what I did. I must have. All right, thank you. All right, we're going to want this tooth to come up in this hole right here. It would have been a devil of a thing for an old surgeon to get that tooth in there. So we took a tooth out. This one moved out. This one is moving this way. Over on this side, I can't see. The x-ray's not any good on this one, but it's moved back away too. Now this follicle is round in here. It's coming up here between the baby teeth. Now the follicle will move through bone. It'll also move and dissolve deciduous teeth, but when it gets to the enamel, it can't do it. So let's look at the next x-ray on this case. I'm sorry for the x-ray, but here it is again. That tooth is there. We've extracted it. I don't have the date on that. And now this is 11/12/07, something like that. That's our third x-ray. This tooth has already come around. It's coming up here. This tooth is headed straight down in this hole up here. This one will come in and hit that, and this follicle shoves it away here, and it'll push it there, and it'll come down through there. This tooth is already moved out by the follicle, moved the tooth out, and it's coming in. Now here we go for the fourth Panorex that I took. This tooth that was hopelessly messed up here is coming down in the mouth, and this one is coming down too. This one's falling right in place, and it was running into the top of this tooth. This was hopelessly crowded, and then this follicle will push against that root, and it'll move this tooth further out, and it'll come on up. This follicle is rounding out here. I lectured on this at a meeting, and the people on the board. I said, has anybody ever heard of follicular movement of the teeth? And there wasn't a person in there that had ever seen it. And I have talked about it for years. Now I know that some of them knew about it, they just weren't using it. Now, all you have to do to use it is to realize what can take place by something. If you think of a tooth that's sticking up inside of a balloon, and you got the balloon full of water, and you push this balloon that had the tooth in it, or your fist in it, against the swimming pool, and flattened it out, and you took your way, it'll move out here till this gets to be a round circle. And that's the follicular movement around. Each tooth has a follicle on it. When it breaks into the opening, this follicle, the tooth comes on in, the tissue of that becomes epithelial, and is what is around the neck of the tooth when it comes in. May be wrong on some of that, but that's the way it does. Now watch this come in again. Now I'm going to go to this number 4, and this is number 5. This tooth is completely away from that one. See the follicle? These teeth have come in. This follicle is eating this root away from this tooth. The tooth doesn't even touch that tooth. The follicle touches it. And it has the cells going in that will eat the dentin and everything else in the tooth except the enamel. And I've taken baby teeth out like that, and they're a hull. There's no way you can make them a hull. But they become a hull as the tooth comes in there. Look where this tooth is coming. Look with this one coming down in that fashion. You'll have to shove this together, but it'll get in there. And now here's the 12-year molars coming in, and I see some wisdom teeth developing around here. Now we sacrificed something in the middle that was necessary to do a tremendous improvement of the position of all those teeth, and it's coming in, and we put some braces on here to kind of help it a little bit down at the end, but made a simple thing out of something that would be extremely difficult if you could possibly do it to get that tooth out where it was. Now this tooth grew up here, but coming around the corner, the root was dragging in the cortical bone, so this one was dragging in the cortical bone over here too, and so these teeth have a crooked root on them. You wonder how the devil the tooth did that. This root was over here somewhere. Now this will come on up, or you may have to you'll have a hard time rotating these teeth like that to get them in place. Now that's number 7. I don't know whether I've got another video or not, but let me see. Yeah, there's number 8. All right, that tooth came in and the crown of it is curved. It's best to just leave it with a certain amount of curve in it, because the root would go out and maybe come in contact with the other teeth over there. But this has made this a simple case. And if you knew about follicular movement, you could do this. I don't know, I hope I've got a 9, let me check. I don't. But this tooth will come on up. It's better to leave it with a little bit of a crook in it down here than try to straighten this out and shove that crook. You may get it involved in the root over here. Now this will come in, and the person has a little more room for their wisdom teeth. Whoops, coming in. So I'm going to say goodbye on follicular movement. And if you don't know about it, we've got it in videos and things. We'll show you how to do this. And that made that case very simple. And it would have been a case that you wouldn't even want to look at to try to do it without knowing about follicular movement of the teeth. So I'm going to say goodbye, and I hope to goodness that this can be taught in dental schools to everybody that's messing with children. Ought to understand about follicular movement of the teeth and what can be done with it. So I'm going to say goodbye and tune into our website. This will be a video now somewhere, and I won't be talking on it, but I'm going to